Hello, my name is Cassandra Romas, and this is 30 Medical Minutes. Today our topic is about a unique improvement in the recovery process for surgical patients. Dr. Jed Calata, a colorectal surgeon who is affiliated with Overlook Medical Center in Summit, New Jersey, is going to discuss the relatively new protocol called ERAS. This stands for Enhanced Recovery After Surgery, or ERAS. After you listen to Dr. Calata, you're going to wonder why our healthcare professionals did not put this protocol into effect even earlier. Based off of a system that emphasizes communication and information, a patient is counseled about his or her upcoming surgical procedure in advance and is given recommendations regarding nutrition and coping with pain after surgery. In addition, the patient is monitored and overseen carefully after surgery, even months after the surgery has been done. Stay tuned for an interesting and illuminating show. It may be very helpful for you in the future. And now let's welcome Dr. Calata to 30 Medical Minutes. Thank you, Dr. Calata, for joining me today on 30 Medical Minutes.
Oh, thank you so much for inviting me.
It's a pleasure to have you. Before we get started, can you give us a little bit of information about yourself and your background and your practice?
Yes, absolutely. Again, my name is Jed Calata. I'm a colorectal surgeon practicing at Overlook Medical Center in Summit, New Jersey. I trained in Chicago in general surgery at the University of Illinois, Chicago, and then I did my colorectal surgery fellowship training at the historic Cook County Surgical Fellowship in Chicago as well.
Okay, and you say you practice here in Summit, New Jersey?
Mm-hmm. Yes, I do.
Okay, very good. Okay, so since you're a colorectal surgeon, what does that mean? What sort of illnesses and conditions do you usually take care of?
Sure. So colorectal surgery is a surgical subspecialty. We focus mainly on problems of the abdomen, namely problems of the colon, the rectum, and the anorectal area. And so for the abdominal procedures we do, we take care of cancers of the colon and the rectum. We take care of infections of the abdomen, such as diverticulitis, and inflammation problems such as inflammatory bowel disease like Crohn's disease or ulcerative colitis, as well as emergency conditions like obstructions or perforations if need be.
Okay, so you have a wide range of surgical things that you have to do. So our topic today is a rather unique one. It's not about any one of these particular illnesses, but it's about the process that you are using or have started using, taking the patient through the whole process, enhanced recovery after surgery. It seems a little obvious that you would have a protocol for people going through recovery, but this is something that has been developed that is going to make it even better. Is that correct?
That's right. You know that surgeons and physicians have been working since the beginning of surgery itself to make sure that our patients recover from surgery as fast as possible, as safely as possible. And one of the new developments really is the culmination of all the things we've learned over the past 3-4 decades. And this new process called Enhanced Recovery After Surgery is really a comprehensive pathway designed to prepare patients with preoperative counseling, education, optimized health and nutrition, multimodal pain management, as well as streamlined postoperative therapy and care to make sure that we do just that.
But it seems obvious to me that this is what has been done all the time. I mean, when a person goes in for surgery, of course they're going to be overseen by the doctor in advance, and of course they're going to be taken care of immediately after surgery. So what's new about this?
What's new about this really is, like we said, that we've taken the best things that people have been doing all around the country and all around the world and chosen what we thought is the most effective parts of each of those lessons that we learned in the studies that we've done over the years. And we put them together in a multidisciplinary process involving each of the medical teams that are involved in a patient's care before surgery and after surgery to make sure that we're doing the very best in each component.
So it seems to me that you're creating a team. You're creating a team approach to a patient's journey through the surgical procedure from before and after. Preparation, almost during, and then after. Is that what we're seeing? We're seeing as you say, multidisciplinary approach. I'm a little confused though, because it seems to me a patient has always been prepped and taken care of afterwards. Tell me again why it's new.
So we're going a bit and beyond what is normal, I guess I would say. And so what we've done is we focus not only on just the day of surgery or even the immediate day after surgery and where we can do our very best, but we learned about understanding the trauma of surgery and how a patient recovers from surgery, that preparation for that surgery can begin even months before the surgery when done in an elective fashion. And so what we've discussed with is, what we brought together is a pathway to help prepare patients for surgery ahead of time, optimizing their nutrition and activity level, as well as make sure that they understand what's going to happen during surgery, so help them recover and understand when they go home that they're successful.
Okay, I just heard the word that really puts it, makes more sense to me. We're talking about a system that is for people who are having an elective surgical procedure. So it's not like an emergency, you have to take somebody in, you have to take care of them right then and there. This is about a procedure that has been planned in advance, and so therefore you're allowed as a physician to take the patient step by step through the process. So you're telling me that a patient is going to be educated from way in advance, educated about what's going to happen during surgery, and then educated about what's going to happen after surgery. Is that correct?
That's correct. And so what we learned again is that surgery doesn't begin when the knife enters the abdomen or makes a cut on the skin. Successful surgery begins way before that even happens. And so we begin that in the office and then in the clinics ahead of time to make sure our patients are well educated. And then it all continues during the surgery and after the surgery to make sure that we do the best possible surgery we can do and help decrease the amount of recovery that they need afterwards.
Okay. Well, it seems to me, and I'm thinking about the whys of this whole process, that why hasn't it been like this? Why hasn't this approach, why hasn't this protocol been used throughout all these years? And it occurs to me that everybody on the team throughout this journey has been concerned about their own little area of expertise. Of course, you as a physician are most concerned about the surgical procedure that day. The nurse in recovery is concerned about the patient during the acute recovery period. You need a therapist afterwards. A person's concerned about the therapy afterwards. What you're telling me is that the enhanced recovery after surgery system is taking everybody and making a team out of them.
That's exactly right. And again, what we've done for enhanced recovery after surgery is not make any one revolutionary point, but the point is that we've taken all the lessons that we've learned, again, over the past 30 years that people have done and practices that have been good practices to help patients through surgery, and really combined them all together. And we queried and involved the other medical teams involved in a patient's care, including the nurses, the therapists, the nutritionists, pharmacists, anesthesiologists, to make sure that we bring the highest level of the cutting edge of data and recovery process to this pathway. And what we found is that by combining all the smaller things that we've been all doing to make sure that our patients get better and putting in a systemized approach, that our patients are getting better faster, going home faster with less pain.
Okay, I'm beginning to get the picture, doctor. Is this procedure, this wonderful ERAS system, just for people who have colorectal surgery, or can it be put into other surgical procedures?
This mindset for what we're doing is particular to colorectal surgery, but it has been implemented in many other kinds of surgical fields, including thoracic surgery, OB/GYN surgery, as well as bariatric surgery in particular, where it's really taken off. And really it's about a mindset about making sure that we optimize and modernize our perioperative care, involving all the best specialists that we can to make sure our surgeries are as successful and safe as possible.
Okay, so to repeat, what are your goals in having this protocol system?
Mm-hmm. Our goals are overall is improve surgical outcomes with decreased pain and less narcotic use, shorter recovery, faster return to function for patients returning to their lives, decrease morbidity and complications to make sure that we minimize them as much as possible, and as well improve patient satisfaction and patient empowerment, making sure that they're involved in their care, that their success in surgery is part of their responsibility and part of the thing that we have to educate them to make sure that they recover quickly and even when they leave the hospital at home.
Okay, so let's take a patient. Give me an example of a patient who's going to have an elective surgical procedure. Can you name one particular illness that would fit into this category,
Mm-hmm.
and then take this patient step by step through the process, starting with pre-op?
So a lot of times, for instance, a patient that was found to have colon cancer, they're found to have colon cancer on a screening colonoscopy without any symptoms. And so what we do at that point is make sure we work up the cancer and make sure that they're suitable candidates for surgery. Once we decide that, you'll meet with me as your surgeon to discuss what the diagnosis means, why and how are the steps of surgery, and what are the expected steps of how they recover from the postoperative process. And what we've done in terms of preoperative preparation is take a step beyond that. What we've arranged through our Atlantic Health System at Overlook Medical Center is to arrange for you to meet with all the specialists that you'll be taking care of, that will be taking care of you rather, during the hospital. So you have a clinic meeting with the anesthesiologist to make sure that they review your health records, your past medical history, to make sure that your health is as up to date as possible, as optimized as possible before surgery, so that you understand the steps of the anesthesia that you'll be undergoing, so that there are no surprises, no scary parts before the procedure.
Okay, that's good.
They identify if there's areas of weaknesses in your overall health, and that includes even your cardiopulmonary health and exercise level. And so they can recommend exercises and workout routines to make sure that you're as strong as possible before surgery. The other thing that we've learned is that preparing for surgery begins not only on the exercise level or just mentally knowing about it, but also on a nutrition level. Surgery is very stressful for you, and that stress of the body takes a toll on one's nutrition. And so we've scheduled for you to meet with a nutritionist to help you make sure that you optimize your nutrition levels, to make sure you're as healthy as possible so that you can deal with the stress of surgery and recover quickly. And also they can educate you about any dietary restrictions that you may have after surgery, so that they can give you helpful food guides so that you know what to eat and not what to eat. And also, basic recipes that might be helpful for you to cook healthy for yourself at home.
Wow, sounds like a campaign that you're putting together here. I never expected to hear that you were going to talk about exercising in advance of surgery, that you have to meet with a nutritionist in advance of surgery. Is a nutritionist going to tell a patient what to eat and what not to eat prior to the actual procedure being done by you and your colleagues?
Yeah, and that's part of the things that they identify with you. What foods will be good to help you kind of bulk up before surgery, much like a fighter will prepare themselves for surgery. Surgery is very stressful and harmful for the body, and so the better you can prepare before surgery, the better that and healthier you will be afterwards.
Well, what sort of foods are you talking about?
Foods that are very high in protein and high in calories, and generally we don't think about that way in terms of general health, but are very important in bulking your body up and making sure that you're prepared to deal with the stress of surgery. Part of that's learning about what kind of foods to eat, and also we've worked with designing and purchasing nutrition shakes that kind of make it very easy for you to do those for yourself.
Well, I never even thought of that I would have to have protein shakes, a lot of protein and carbs. It's almost as if you're running a marathon and you have to bulk, and you're saying bulk up. Is that because after surgery a lot of people lose weight and become weaker, so this gives them a head start in advance of that?
Absolutely. And so what people might not know or might not understand is that you certainly lose weight because you're not able to eat immediately after surgery. That's partly true. But what we also know is that the body has to heal itself. And so when it does and is recovering from the stress of surgery, it requires a lot of protein and nutrition in order to build back your body and heal all the things that we do to you during the surgery to make sure that you recover properly. And the more nutrition you give ahead of time, just as you say, when you're preparing for a marathon, the better that you'll be afterwards.
Okay, I'm beginning to get the picture here, doctor. So our patient who's having electric surgery has met with you, has met with a nutritionist, has met with the anesthesiologist, you said, and you also mentioned pharmacist. Why would they be meeting with a pharmacist?
So it's very important to meet with the pharmacist to make sure that they can review all your medications so that you know which medications you need to hold prior to the procedure, which medications are going to be continued prior to your procedure, and also to give kind of one-stop shopping to pick up all the medications that we may prescribe you new from that visit so that you have everything all in one go.
Are you telling me that you can pick up all your surgical meds prior to your procedure? So
Yeah.
you're all set up and you're ready to go?
That's exactly the plan. We want to make surgery as streamlined as possible for you, as easy as possible for you and your family, and as easy to understand as possible for you and your family. So it's almost like a turn-by-turn directions for you to successfully get through surgery.
Okay, well, I like this. I like knowing what's going to happen. It makes me feel a little bit more confident and reduces, as you said, the stress. So if you're informed and you have a team approach, then it's going to make me feel a little bit more comfortable, even though I'm still worried about going in for surgery. So that's good. That's a good start. So what happens on the day of surgery? We've been prepped and ready to go, and I've had a lot of protein shakes. What's going to happen now?
So we've worked very hard to make sure that we prepare you for surgery. And so when you come into the day of surgery, hopefully there's no surprises for you, that you've been prepared for all those things. On the day of surgery, we work with the anesthesia team to make sure that we give you a surgery that is as minimally painful as possible. And that begins even before we even make an incision. And so in the preoperative area, we give multiple medications to help control your pain even before we make an incision, and as well as to decrease side effects from those pain medications. In addition, again, before we even make an incision, we have the anesthesiologist do a special numbing block to the abdomen called a tap block, using a relatively newer medication called Exparel, which can numb the belly for almost 3 days to make sure that your pain after surgery is as small as possible.
Oh, that's interesting. So you're telling me that you're doing medications in advance to reduce the amount of pain that you're going to feel immediately after the surgical procedure.
Exactly. And
so that you don't have to give the pain medication as soon as the surgery is done.
Exactly. And
okay, so you're anticipating this.
We're anticipating it. And so we're not waiting pain to happen to you, we're preventing pain before it happens.
Aha! I like that. I like that. So that means when you come out of the surgical procedure, you're not going to be all bulked up or tense, even though you're in the ICU and everything like that. Your body's going to be a little bit more relaxed, and therefore
Exactly.
you're going to have less, I don't know, whatever you call it, in the ICU, right?
Yeah, less pain and discomfort, much more comfortable, and hopefully you'll wake up from anesthesia just, wondering where the time went.
Oh, good. So you mentioned that you want to make it a surgical procedure as quick as possible with as little invasion as possible. What do you mean by that?
And so as colorectal surgeons, our group has really committed to performing what we call minimally invasive surgery. And that's surgery with as small incisions as possible. We do this if it's safe, of course, number one, but also we use laparoscopic and robotic techniques to make this happen, to do it through very small incisions. To do the same surgery we would do through an open approach. And so we perform the same surgery with as small of incisions as possible, as safely as possible, as quickly as possible, to make sure that we do as little trauma to you as we can.
Well, I'd like that, and of course the fact that you have a very small incision means that you won't have these big scar tissue, and if you try to get up or anything like that, it's going to be far more difficult to do so. So does that mean that with a smaller incision and quicker surgery that the patient's going to feel better faster?
Yeah, that's true. And so we have not come to the point where we can do painless surgery, but what we've been trying to do by combining all these approaches, a preoperative anesthesia, pain prevention, as well as doing surgery through the smallest incisions possible, is to make sure that the surgery is as painless as possible.
Okay. Now, if a person's in the ICU, of course you're going to have the incredible nursing staff right there. Are they aware of this process that you've put into effect, that the patient has received these pain medications in advance and so forth? Are they a part of the team?
They absolutely are a part of the team. So very rarely do our postoperative patients need the intensive care unit. Most of the time that they are very happy and stable afterwards, they can go right to a regular specialized surgical floor. And what we've done in the postoperative setting is to make sure that we have a specialized floor that is very familiar with colorectal surgery patients. And so what we've done through education of our nurses and therapists is that we have a specialized recovery floor where they are familiar with the procedures that we do. They understand the goals and kind of roadmap of the recovery process. And that's really helped us help our patients get up out of bed faster and recover faster and be able to anticipate the patient's needs as it comes about.
Well, that's good. I've learned a lot from you, Dr. Calata, but I was just assuming that a patient would go into ICU. It's very nice to know that they don't even have to do that they can go straight to the appropriate colorectal floor, where everybody is in tuned and they know exactly how to treat a person with that type of surgical procedure. I keep on thinking about the pain component here. Everybody is so worried about pain, and in today's society, everybody is concerned about opioid abuse, dependence upon narcotics and everything. I can see that one of the advantages here is that you're eliminating the possibility of that happening. Is that correct?
Yes, that's correct. And our goal is to try to operate and have you recover successfully without pain, hopefully without needing narcotics whatsoever. That is not always true, as pain is a very personal thing, and each patient feels pain separately and differently, and sometimes people need narcotics, but the goal is to make sure that we treat your pain through multiple different ways to decrease your need and dependence on narcotics as much as possible.
Do you find that as a patient, well, how long does a patient usually have to stay in the hospital, anticipating that they haven't had any extra medical incident happen to them?
Yeah, after a regular abdominal procedure, if we're able to do it in a minimally invasive fashion, what we've been able to do is decrease hospital stay and the amount of time that's needed in the hospital. A lot of our patients are going home as soon as 2 days or even 3 days after surgery. Yeah.
And are you telling me they can regain their functionality and go back to the work even, or their daily lives without too much trouble?
So the process going home is step number one. Okay, and so recovering from the stress of surgery takes a little bit of time, but the short answer is yes. You don't go back to work in a week. It takes time to kind of build up and heal up all the way, and that process usually takes about a month or two. But in short, the less invasive and the less stress that you undergo through surgery, the faster that you're going to return to work and be functional again.
Do any of these patients have to go through any sort of physical therapy? We are talking about the intestinal area, and of course, sometimes you have to have external equipment added, so people are concerned about that. Well, how do you handle that?
So each of our patients in the postoperative period get evaluated by the physical therapist to make sure that we understand and can anticipate their needs prior to them going home. And so what we do is we have our physical therapist work with you, see what your activity level is, making sure that you're safe before you go home, and if you need special equipment that we arrange for them to have that. And if you're not ready to go home, or say you live by yourself, or the patient's mobility isn't up to where they'd be safe at home, to arrange a comfortable rehabilitation facility that's nearby home or friends and family where they can continue to recover.
So you're saying that this wonderful help and assistance to the patient is all part of your team approach?
Yes, and again, it is standardized, so to make sure that it is part of your recovery process, not only making sure that you're recovering from the pain of surgery, but that you're prepared and successful when you go home, because as we discussed, your hospital stay hopefully will be fairly short with us, but your recovery continues on when you go home. And so the goal is to make sure that you're successful at home, whether it be in understanding what foods to eat to make sure that you recover well, having activity goals to make sure that you stay active and strong, as well as to be able to anticipate any problems you may have with pain or discomfort, and to make sure that you know what to do if they should happen.
In that case, do you think that patients need to have somebody staying with them or having some sort of nursing aides come in on a regular basis? How does that happen?
It's on a case-by-case basis, really, with how active and independent you are after surgery. I'm very happy to say that with our technique using the ERAS pathway and minimally invasive surgery, that a lot of our patients are able to be active and independent even when they go home, albeit maybe not up to their normal level, but safe at home. But that really depends on your comfort level and what kind of support system you have. The number one part of importance is your safety and comfort. And so if you should need additional help at home, and we can identify that with our physical therapists, we work hard with our case managers to arrange that.
Okay, well, you're providing me with a very interesting story about helping a patient as a person, as an individual, not just as a compartmentalized person, taking a person through the entire journey with a lot of respect, actually, a lot of education, a lot of information, and anticipating their needs so that they recover with more understanding of who they are and where they're going to be, which makes, of course, by reducing the stress, you don't need meds as much, I think, and also you feel much more comfortable that the outcome is going to be a good one.
Exactly. In medical school, they teach us 1 ounce of prevention is worth 1 pound of a cure. And so we've tried to take that approach using the ERAS pathway to make sure that our patients understand not just the surgical procedure, but the before and after as well. And so what we've learned is that surgery, recovery, and success doesn't begin when I make an incision on the skin, but can start months before in terms of preparing you to understand the surgery so that you can be successful even when you go home. And that process starts way before you walk into the hospital and continues on after you walk out of the hospital as well.
Well, it sounds like there's a tremendous amount of advantage in this system. Does the patient have a choice in choosing ERAS, or do they have to ask for it, or is there a special way you can make sure that you have this protocol put in place for yourself?
If the patient's healthy enough, it is our current standard of care. And so for all of our elective patients that are a candidate for this approach, we approach it this way to make sure that they get the best possible modern perioperative care.
And what about other surgical areas as well? Can they ask for that? Let's say if they're having thoracic surgery or other type of surgeries.
You can certainly ask for it, and I encourage you to do so. The one caveat is that as we've discussed, that you have multiple shareholders in this process, including the nurses, the therapists, the anesthesiologists. And one of the things you asked earlier in the program is, why haven't we done this sooner? Well, it's a difficult process to put together to identify what is the best possible parts that we can put together to make this process run as smoothly as possible. And it takes time to build a culture of safety, success, and efficiency to make this as successful as possible. And I'm very glad to say that we've been able to accomplish that at Overlook Medical Center. And I encourage you to ask your physicians and other surgeons to see if they're able to do the same thing.
Well, thank you so much, Dr. Calata, for joining us today. It's been most informative and most illuminating. And we appreciate your being here. And thank you for joining us today on 30 Medical Minutes.